I guess we can start and hopefully more people will show up so we hit quorum. But to get us rolling along, it is 6:03 and I would like to call the May 27th, 2025 meeting of the St. Louis County Youth Advisory Council to order. And I will hand the second item roll call over to Mrs. Hughes.
All right, bear with me. Uh-oh. Sorry, guys. I'm looking for my list. I just got off of another call. Sorry. Okay, well, guess what? I'm gonna look for it. Is there something else you can do while I look for it in my emails? I do apologize.
I could send you a list real quick. What email do you want me to send it to? Just the name of the email. What county?
I'm sorry, I didn't hear you.
What county email? Whose county email you want me to send the list to?
C Hughes 3.
That's enough. That's enough.
Okay. Sorry about that.
Just give us a quick second and I'll have that list to her so she can help you all get going here.
Thank you, Jen.
You're welcome. Just,
And one of
it
those
won't be
days.
a pretty looking list, but you'll have it. There you go. You'll have all the names on an email so you can just send it. So.
Yeah.
And just, Madam Chair, if I may, if you don't achieve quorum or until you achieve quorum, you can certainly discuss. It won't be an actual meeting. And you won't be able to vote on anything. For example, you wouldn't be able to approve your minutes, but you are fine to go ahead and just have discussion.
All right, Jen, thank you. If we're ready to go ahead with roll call, it would be great. Precious Berry.
Present.
Vienna.
Present.
Isabel. Isabel. Okay, not here. Anne Marie. Annika.
Present.
Preston. Preston. Legacy. Legacy. Gary. Gary. Tiernan. Tiernan. Margaret. Margaret. Evita. Evita. Neha. Neha. Jordan. Akil. And Michaela. Okay, Madam Chair, roll has been called and a quorum we do not have. I'll turn it back over to you.
Thank you. So we can't approve meeting minutes, but the next thing on our agenda will be hearing from our guest, Mr. Street. He is the community health manager from St. Louis County. I'll give you a few minutes to just discuss what your role is in health, as we've been doing several different research reports and projects on that, and we've been curious about many different aspects of mental health, how St. Louis County collects data, and just generally how the Department of Public Health for St. Louis County works and how it attempts to help the county residents. So I'll hand that over to you, and then we'll ask you a few follow-up questions or just some things we've been curious about. So thank you so much for showing up tonight.
Well, thank you all for having me. Can you guys hear me? Good?
Yeah.
All right,
Okay.
good. You're in my basement, so I was nervous. But yeah, thank you for having me. So my name is Keith Street. I have been with St. Louis County Department of Public Health for, I think, 18 years, long enough where it's getting kind of fuzzy. I've actually had the ability to work in a lot of different divisions, which is amazing. If you're not familiar with the health department, we do a lot of stuff. I did not know everything we did when I joined, but we do everything. And I've been able to work in my current role as community health manager, working mainly around substance use, some chronic disease stuff. So I have been in all 4 of the clinics. So I've been in all the 3 community clinics plus RGL clinics. I've been able to work with SMI patients, which is serious mental illness patients. I've been able to work with a lot of the people suffering with chronic diseases, getting them better. And then also on some large grants that had smoking initiatives for the smoke-free ordinances that went through. A lot of those schools I worked with, having them pass their internal policies for tobacco-free or nicotine-free schools. And I've done lots of presentations around everything and anything. So it is a lot that we do. So within behavioral health, I think it's kind of what you guys were looking at more of it. Behavioral health kind of is an umbrella. So behavioral health is a term that's kind of newer-ish, I'd say, that kind of has mental health and substance use kind of in those kind of umbrellas on it. A lot of the work that we do within the health department is going to be a lot more on the substance use. We do have behavioral health where we have counselors. We have counselors within our clinics and within the jail. We have psychologists and psychiatrists, so we can do that kind of primary psychiatric care for our patients that are established within those clinics, those 4 clinics that we operate. We also have done and are looking to re-engage around our dashboards for data around mental health. Mental health is kind of hard to get good data on. There's a lot of stigma around it. There's a lot of stigma around substance use that I deal with, but there's a huge stigma around mental health, and it is very hard to get good data on it to be able to share on it. But we, pre-COVID, had an epidemiologist, which is someone that's able to mine a bunch of different kind of data sources, take it in there, break it down, make it usable, put a report on it, and then hopefully give suggestions. So pre-COVID, we had a dedicated mental health epidemiologist that was kind of creating some snapshots of St. Louis County, mainly around kind of like depression, bipolar, some of those like larger conditions that you're probably more aware of. When COVID happened, all that stuff kind of stopped, and we really haven't re-engaged with it. It's something that we're hoping in 2026 to really kind of reinvest in. We're actually, on my team, I have public health coordinators, epidemiologists, health education coordinators, as kind of underneath on my team on it. And we are actually going to have a public health coordinator dedicated to it, to the mental health aspect of trying to rebuild our programming with it. And also a health education coordinator that's going to be able to go out and do some of this education. And we'll probably start around stigma for the most part of like basic awareness of, hey, here's the snapshot of our landscape of mental health within our community. And then to do some very basic kind of like resource identification. My team will not be doing direct services to patients. Our clinic does have the ability to do it, but we also have a lot of community partners we refer out to that have been established, that have done it and do a good job with it. Not that we don't do a good job with it, but we have partners that this is what they do, 365. So we kind of have those relationships set up. around substance use is kind of the other umbrella, and that's something that I can talk to you, and by all means cut me off when you need to, because I can talk about this forever. We have a lot of different programming around our substance use. So my team helped to launch the first PDMP, which is a prescription drug monitoring program. We don't operate it anymore within the health department because the state actually adopted a statewide one. So we were able to transition it over to them. But we were able to initiate it and kind of do a pseudo state prescription drug monitoring program for the whole state because they did not pass the legislation to do it. We were the last state to do it. Guam, Puerto Rico all had a PDMP. We did not. So that's the reason why we were able to take that initiative and actually create one and work with our county leaders, work with our state leaders, and then we even had to work with the senators up in DC to get federal legislation changed to allow funding to go to local entities, because all the legislation was written for states because the states should have been the one doing it. But we kind of filled that need for it. But when we launched the PDMP, we had a bunch of data on it, and we were able to kind of see the spikes of, at that time it was heroin, mainly, those heroin deaths around the opioids. So we were able to see the spike on it, and we knew that we needed to do something to address it because they were just rising exponentially, and we needed to do something. So we knew that PDMP was going to be a good tool. So we actually created that. But before we did that, we also knew that when you would implement this, that you could have doctors, physicians, pharmacists, whoever it is, could actually start kicking patients off. So we had to do a lot of education. I did a lot of grand rounds, which is pretty much going into the hospitals and doing like little mini lectures. You feed them and then they listen to you, and you talk to them about different tools with it. But we had to talk with them about, hey, like with this PDMP, it's going to equivalent their MME, which is morphine milligram equivalent, they have access to. So you're going to be able to see how much access they have to it. It doesn't mean that they are abusing their prescriptions. And even if they are abusing it, that is not a reason to discharge a patient. That's a reason to have a good discussion with the patient. And we gave them the tools. We gave them the links that they could use. We even worked with them to get, at that time it was called, you had to get a waiver to be able to prescribe medicated assisted therapies. But we worked with them on, and hey, this is discussion. This is your patient. So even if they are abusing it, this is a time for you to have a discussion with them and to actually, set up and figure out their health and the wellness on it. So we did that. We also knew that we were going to transition people off of prescription drugs, probably to illicit. So we had to flood the market with Narcan, which I'm not sure how aware you all are of Narcan or naloxone, but we did a lot of training. So we trained all our police officers. We trained a lot of our first responders. We started a mail-out program, which we still have. So any county resident, there's a QR code, and I'm sure I can share it if you guys are interested in stuff on it after the meeting for the QR code. But any county resident can pretty much scan this QR code, and it's a very quick survey on it that we just need a valid county address, and we will mail out Narcan to anyone in St. Louis County. We also have a few grants that we're going to be putting Narcan vending machines, like low-tech ones that kind of look like the newspaper boxes. I'm not sure if any of you people know what those are, or I'm dating myself, but the newspaper boxes, they're low-tech. And then we are also going to be putting 4 high-tech ones that have a full video screen that'll be showing videos that we created on, hey, how do you identify an overdose? How do you administer Narcan? Which is super simple to do. And if any of you guys want a training on it, my division also will do trainings for any community members, any organization, and be able to do that on OE&D, which is overdose education and naloxone distribution, to say, hey, how do we identify it? We go over the kind of the trends on it. And then we go about like the whole steps of like, do you administer it if they don't have a pulse? If they're not breathing, do you administer Narcan? You don't, because you need to be able to go through the system. So you have to do CPR first, and then you can administer it. Always call 911, because the half-life of the illicit substance they're using could be longer than the actual Narcan with this, so they can actually re-overdose without it. So we always say to get to the ED or the emergency department with it. We also do other data that we have a dashboard on there for drug checking. So that's something new that we have under a CDC grant that I helped oversee, where we actually work with community partners to gather paraphernalia or samples of street narcotics. And we actually are able to test it and report back out what's in the drug supply. We are only about a year into it under this grant, but we will get samples and people will think it's this certain drug. And we'll actually be able to show them like, hey, like here's the presence of fentanyl. Here's how much xylazine in it. And then when we know this information, we're able to take that and create education to put out to the community members, whether that is like a health alert to providers being like, hey, like you might have people reporting to you in respiratory distress because of this, and they're not your traditional like opioid user. Or it could be directly to those people who use drugs and be like, hey, be aware of your supply is tainted. And here's what you can do with it. You can not use, but we also work in a harm reduction kind of mindset where we know that that's probably not going to happen, that they probably still will use. So how can we make sure that they are the safest they can be so that way they live tomorrow? I mean, to be really kind of bad about it, but that's my goal, is to make sure that I give the person tomorrow to make another decision. Like I say, so we do have all those programs with it. We have publicly accessible dashboards around overdose. So I can share those links with it. I can actually show it on it, but it'll show the trends on it. It's normally 6 months behind because they have to be finalized. So we work very closely with our ME, our medical examiner's office, to get those data points on it. We are also trying to do some syndromic surveillance with our emergency departments to better capture non-fatal overdoses, because those are harder to get, because fatal overdoses, they all come to our medical examiner's office. So we can capture those. We know those numbers pretty well. Your non-fatal ones, when people are reversing that overdose, whether it's at the hospital or at home, that's harder number to get and to really capture on it. And the data that we're showing on it is that the deaths actually have been decreasing. 2024 numbers are not finalized, but opioid-involved deaths, substance use-involved deaths, have decreased. And when they do get finalized for 2024, it's going to be a pretty significant decrease, in all honesty, which is great. But that doesn't mean that we have less people using or any of that stuff. It just means that we're saving people's lives, which is great. That's the public health kind of approach to it. That's the harm reduction approach to it, is making sure that we mitigate those risks as much as we can. I'll breathe.
Okay. I'll open the floor to any questions. I know I have 4 or 5, so I'll let everybody else to go before it's my turn.
I was just too thorough.
Oh, no, Annika, I was just saying I'm interested in hearing your questions first. We might have similar, I don't know. I just want to hear what you have in mind first.
Okay, so I think the first question is gonna be, you said that like overall opioid deaths are decreasing. Do you think that's because recently there's been more education about it starting younger? Because I know at my school, I think last year was the first time we did a school-wide assembly that really talked about the dangers of like fentanyl. And I know everybody says drugs are dangerous, but do you think that like increase in education is the reason that this is being curbed, or do you think it's more like relating to like the amount of Narcan being dispersed? Or
I think it's a yes and. So I do think, and one thing that we also have, and we actually just last week we have a campaign, communication campaign that we're doing. So there's a billboard. So if you drive down 170, you see like a big old colorful billboard talking about Narcan availability. So we hope that the education is helping with it, but it can't just be education by itself. The Narcan and the amount of Narcan that we've had in the community is definitely helping. I mean, I have in my office that we just got a shipment of, I think it's 110,000 doses, maybe, or something crazy like that. I think it's going to end up, it's about just under $500,000 worth of Narcan that we're probably going to distribute this year. So we are flooding the market with it. We are also trying to work as much as we can, like with anyone and everyone, talking about the awareness of it. I think fentanyl is something scary, and I think people have kind of grown aware of that because it is that really small amount can be fatal with it. We've also been able to do a lot of education around all substance users. So anyone, like a person who uses drugs is kind of the term that we use in the industry with it, but it can be anyone. And like talking to people that would use stimulants and be like, hey, like you're using a stimulant, but you better have Narcan on you. Because a lot of times I don't want to say like cliques or different levels that people think that they have of like drug use in it, but we had to like break those down. Even if those people who use drugs, being like, hey, like any illicit substance, fentanyl's gonna be in it, xylozine's getting in it now, and I mean, there's different stuff on there that we should be aware of. So I think education is a huge thing. I think talking about it openly and talking about it as a chronic condition, because that's actually within my, like the epidemiologists we have on my team are under the chronic disease epi kind of umbrella. And we treat it as an illness. We treat it as, you know, a medical condition with it. So trying to work on that stigma and make it decrease that stigma that you have around talking about either you know, trying to ask for help or like, hey, what can I do to like stay safe? That we've been trying to do a lot on that. So I've been working around opioids for probably the last 8 years, I feel like 8 to 10 years. So it's been a lot of time, but it's starting to decrease. And I think it actually is a legit decrease. The first time we thought it was a blip, but it has been trending. So
Yeah, that's good. And then you've talked a lot about education. I was gonna ask, when are you guys like primarily starting to educate people, and when is the ideal? Is it more geared toward like adults or like people coming on like those prescriptions after like different medical procedures, or are you guys trying to start like a little younger at like high school or like going into middle school when people are first exposed to drugs?
and it's not high school when you're exposed. I have 4 kids, so like I'm totally not the fun dad at all. I've had some very interesting conversations with my kids, but my oldest is going to be a junior, and I go all the way down to a 4-year-old. I've like my 5th grader, I've talked to him about drugs. I don't think it right now is anything on there, but he does know about like vaping. He knows about some other stuff on it. He knows about marijuana use and that stuff. So I'm very open, I feel like, with my kids, but there needs to be education at all levels, in all honesty. So it depends. And like, that's one thing that my team helps to do is to tailor that information. Because if you just have a blanket educational component on it and you put it out there, it can be way over someone's head and they're not going to understand it. So looking at cultural competency, looking at health literacy has to be part of it and making it useful for them. We do have education that we do directly to medical providers around best practices about, hey, how should I be prescribing? Should I look for non-opioids to start? Yes, you should. If I do it, should I check the PDMP? Please check it. That's a great tool we have for you. Should we go slow? Yes. Should you give a 6-day supply as opposed to a 60-day supply? Yes. These kind of educations we do to providers. We also will do direct education to people who use drugs. So we'll talk about the dangers of it. We talk about harm reduction. We'll talk about wound care. We'll talk about, hey, when you're ready to seek help, here's where to reach out. We talk to family members too about it, because you have to educate family members, because if someone is suffering an overdose, they can't administer Narcan to themselves because they are overdosing. So you have to do education directly to those family members. That's a lot of stigma work you have to do on it. For kids, we will go and talk to high schoolers with it. We have another program that's a larger program that is, CHAT. It's like Community Health Advocates for Teens. It's an acronym. I can't remember what it is. Don't write it down because it's probably wrong. It used to be TAC, which was Teenage Health Consultants, but they're rebranded. Part of that component of it, they talk about kind of like, they'll talk about substance use in it. They talk about chronic disease. They'll talk about education. It's kind of a larger kind of program that the health educator can go into the high schools and work with high school students that have been identified and teach them how to facilitate health programming to like those middle school or elementary school that are more play-based. So it's not really deep. Some of the stuff we talk about around like social media is, you know, how easy it is to put something out in the social media realm and how hard it is to take it back. So we give them toothpaste or shaving cream, and we have them squeeze it all out and they make a big mess. And then we're like, okay, you said that really easily, right? Now put that back in because you want to take it back and you can't. We talk about another game about like looking at online and trying to identify what information is real or what's not. It's like a game called Fact or Cap, where like literally they make people like stand on this side and think it's fact. If they think it's cap, they stand on this side and they have to discuss like, hey, why do I think it's this? That's when I finally learned out what cap was, which I feel old on it. My kid kept on saying it. I kept on saying, I swore they were saying crap. I'm like, you can't just leave the R off. I know what that means. But then I found out they weren't just doing it. But you have different types of education for every audience. And that's something that in public health, you have to be aware of. You have to make sure you tailor your information to make it useful. Because if it's not going to be, you know, if there's the health literacy is not there, if it's not culturally competent, if it's not trauma informed, it's not going to land. So we educate everywhere.
Okay, and then I was one of the people on the substance abuse report last year, so I kind of did a deep dive into looking into possible solutions for youth, and that's when I came around and discovered kind of what Narcan was. And I was wondering what's your opinion on the effectivity of having Narcan in schools and like training teachers and possibly training high school students on it?
You get me in, we'll do it.
Okay.
But yeah, yes, I think that we've offered it. So we've done discussions for like the School Nurse Association and some of that stuff on it. When I first started this, schools they would slam the door in my face for the most part. I feel like they did not want to talk about it. No one had a problem. It wasn't our issue. Slowly, the schools are getting on board with it. So there are a lot of the schools that will have Narcan in it. So like they are slowly getting on board with it. But yes, I think that having Narcan available, it's not going to increase drug use, and that's something that we have to like educate people on. Is like having Narcan at your nurse's office or having it in the classroom is not going to increase it. It's just going to be there. It's like an AED. You hope you never have to use it, but you're going to be glad if it is there, because if it's your kid, if it's your friend, if it's your teacher, if it's your student, you're going to want to, let's say, give them tomorrow, and that's what it does.
I think that's most of my questions for now. I'll pass it off to anyone else who came up with anything.
Yeah, Mr. Street, I think you hit on all of my key points that I was interested in asking. I know earlier what came to mind was when I was in, elementary school, we did the DARE program, and that really was a great, benefit to the students with just seeing that hands-on activity. I know that a lot of the students, when we were younger, we used to love when we put like that, I think it was like the goggles we had on our face or something like that, and we got to see what it looks like when you're intoxicated. But the overall was learning about, that health literacy, as you mentioned, and that cultural competency. And I also did wanted to ask, like, are you going to do like any hands-on activities into the schools? Because I know that you mentioned that you all were working with students, but I didn't know if it was specifically in the high schools itself or in the middle schools or in the elementary schools. But I can see that you're trying to get into those schools, and I think that it's very, sufficient to get into those schools to be able to help those students, especially students that are probably impacted in poverty, which we see students, and also in other school districts in the surrounding St. Louis and city and county area. So I think that is a great thing that you are doing, and any way that we can support as the St. Louis County Youth Advisory Council, I think Annika has been a great advocate for us, and yeah.
Yeah, and like I said, I think any school that that will invite us in, and like we reached out to them, but anyone if there's an interest, like we don't ever say no. So even when Charlene asked me to talk for this one, she sent me an email and she said, "You want to talk?" I'm like, "Sure." What am I talking about?
Yeah, I also wanted to follow up. I don't know if you mentioned or I missed it earlier. So do you all provide those Narcan spray boxes? I can't think of the name right now. Are you familiar with what I'm referring to?
I mean, right now, so when we do the talks with it, pretty much everyone that we train on it will give a box of Narcan, which has 2 doses in it. There are like, if a school would want, like I said, we have those like newspaper looking boxes that can hold 200 doses of Narcan. We're never going to put 200 doses in it, but like we can place those. And that's something that currently we purchased 40 of those different boxes, those big low tech harm reduction vending machines. I think we have 29 locations that we've been able to get people commitment from it, all the way from like, I think there's a few Dollar General stores that are taking them to a few of the hotels and the airport. So those are areas that we've seen hotspots kind of on it that we kind of targeted. There's a few churches that we're reaching out to currently, looking at kind of those like where the overdose deaths are happening and trying to identify those locations and work and identify partners to put those on it. We also help to outfit all the libraries. So all the county libraries have Narcan. I don't know if you all know that. But anyone can walk into those county libraries and ask for Narcan. So, yeah, but we have a lot of Narcan that we can put out in those vending machines. So,
And then I was gonna ask, so I know you've talked a lot about like destigmatizing like substance abuse and different drugs. How would you recommend for youth like us on the council to like educate our friends or our parents or our peers and like help with like destigmatizing like or
I think a lot of it's just humanizing it and not seeing. I mean, like I feel like it's something that it's rewiring. I think almost our brains of how we like interact and engage with people who use drugs. And I know, like I feel like I cringe a lot when I people say like addict. I'm like, oh god, I hate that. Like no, like you're villainizing it. You're making it a moral decision, and like a lot of it is. I mean, it can be anyone, and that's like some of the message we have on it. Like anyone can suffer from substance use disorder. So I think it's just like being honest with it, and it affects all of us. I'm sure everyone on this call, it affects, and you know, being open enough with like the struggles with it, and being, if you have like a friend with it that has it, of like being a resource of hey, like, you know, here's where when you're ready to get seek treatment, and you can't force anyone to do it. That's the hard thing with it, and like you can't want it for them, which is hard. So like that's the reason why we lean into like the harm reduction. Just part of it is like I'm trying to keep someone alive so that way they can hopefully decide tomorrow for it. But like everyone, their path there is all different, and it's anywhere from, you know, for opioid use, it used to be the whole like prescription drugs, and then you run out of prescription drugs and you go to heroin also. So it's not that same pathway for opioids really. A lot of people will start because we've worked a lot with our providers, so like they're not over prescribing. The vast majority of them are not over prescribing opioids anymore. They're not flooded in there. We've done a lot of education on my father just had, he's 82, just had a knee replacement, and like I think took one oxy, and he was like, oh crap, I don't want this, I don't want to get addicted. I'm like, you're fine, you know, but like be mindful of it. But everyone's path is different. It's more just like being empathetic and just listening, and you know, knowing where you can turn for help with it. So we are in the process of, under the one of our federal grants with it, of trying to create an update of resource page on it. So hopefully, probably before the end of the year for sure, we should have something on it. It's probably going to be on, I think, Health STL page, but it'll have different resources on it. It'll have our Narcan on it. It'll have our stigma campaign on it. It'll have kind of resource kits for, I think we targeted justice involved individuals, youth, people who use drugs, and then like family members. So they have like different like supports for it and be targeted for it. So hopefully that tool makes it live, and once the grant ends, stays up to date with it.
you said it was Health STL. That was the website.
It's right now it's thinkhealthstl.org. So thinkhealthstl.org. So that right now it houses our CHA, our community health assessment, and our CHIP, our community health improvement plan, which is going to be more broad. But OD2A, which is overdose data to action, is the grant I'm talking about. It pays for that website, so we're able to push a lot of stuff. We're going to be able to push a lot of stuff onto that.
Yeah. And then I think one final question for me, is there any way that youth or people can like volunteer or like help out at all?
I would have to check. It's a little bit more difficult, I feel like, with it. I know we have we'll have like college interns come through. Sometimes they'll help with packing because we do have those harm reduction kits. So we have those Narcan kits that have Narcan in it. It has fentanyl test strips in it. It has xylazine test strips in it. We have other types of harm reduction kits. We have like hygiene kits. We have wound care kits. We have sexual health kits. We have a bunch of different kits that we will bring sometimes college students in to help to do it. When you are working with minors, sometimes it's a little bit more difficult, and I really don't know the answer.
Okay. Thank you. I'll give a quick round if anyone has any final questions or anything.
I don't have any questions, but I thank you, Keith, because I know you are extremely busy. So I appreciate you taking time out of your evening to speak
Yeah.
to the council and provide a lot of relevant and valid information. Thank you so much.
And like I said, if you guys want an O&D training at any time with it for your schools, for any youth group you're in, or any churches, anything, reach out to us, and we'll be there in the county because we're county funded by taxes. But all right, well, thank you all for your time.
Thank you.
Thank you. Okay. Moving on to the next part of our agenda. It will be the presentation for the concentrated poverty group. So I'll give Precious, you have like 7 minutes to present. So take as much time as you want. Or okay.
Hey, hi guys. So okay, sorry, I just pulled over. Okay, so specifically, this is my specific proposal. I don't know if you have it up, Annika. Am I just presenting? Am I just presenting? I'll just say, yeah.
And just tell us about it. Yeah. No. You're good.
Okay. So specifically, I focused on combating concentrated poverty in St. Louis County. So for me, I grew up in River Garden School District that is mostly part of the 63136 zip code. So I've always had a passion on just poverty in St. Louis, as a person who has come out of a community that has been impacted by poverty. I don't allow my zip code to define who I am. So for me, I'm always quick on like finding solutions, finding ways to rectify any injustices that might happen in my specific neighborhood of where I grew up, and just trying to change that narrative on this specific district or the specific zip code and other outside zip codes that I might mention, such as the 63137 zip code that composes students in Normandy, etc. So specifically, I learned that concentrated poverty is not just about low income people. It's more about like deeply rooted segregation and disinvestment that isolate mostly of the neighborhoods that I grew up in, and also at the school districts, since we're speaking about youth, such as like Jennings, Riverview, Normandy, some parts of Ferguson, and Delwood. So basically, a lot of these families, like, they experience multiple systemic barriers, such as low income. Also, some districts can be affected by low economic development. A lot of these students are eligible for free reduced lunches, which means that, of course, these students are coming from poverty, transportation, food insecurities, etc. Food deserts, etc. So pretty much that was just the background and the basis of how I created the specific proposal. I don't know if anyone else saw it, but my proposal is everywhere because I did not know if someone else from my group wanted to add in specific information. But I kind of created some of like the key logistics that I could use like moving forward. And also going further, like speaking on like the educational level of concentrated poverty, a lot of the schools have like fewer AP courses. As we know, AP courses that are in school districts could elevate students in their educational career, such as with math, with English, with science, etc. I know that in my high school, I was the only student in the whole entire school in my senior year that was in an AP government class, one student. I did question like multiple times, like usually if you have a low enrollment in a class, you would think that they'll cancel it, but they did not cancel it. But like situations like that, like we should be able to push more of economic development into school districts so our students can have more resources, etc., or to have more educational resources, put more funding into our school districts in a way of students can have better educational outcomes, etc. So some of the solutions that I came with specifically was first, the Youth Equity and Opportunity Zone, and I called it like YEOS or something like that. I just basically put all the words together, but it was designated, of course, in high poverty areas, and these zones will kind of receive targeted investments in youth workforce development, such as, recruiting students or young people for internships, job training, mentorship. I know that for me, mentorship has not only changed my life, but it has also opened up a lot of doors for me, and having a lot of um, mentors in my life, even when I, started off in politics or started off in just learning more about my community because of how invested I was, I started to see a lot of doors open up for me, such as speaking, seeing a lot of opportunities in the community. And I feel that how our community is kind of constructed, if you're really not out there looking for the resources, it's kind of sad, but the resources isn't really going to come to you. So that can be such as if you're not engaging on social media, if you're not coming to any events. It's not like I have people knocking on my front door saying that, hey, do you have any young people in your household? This is what we're offering. It's more of actually being out in the community, and I got to see more of the resources. So one of the goals of what I was thinking of is that if we actually promote more to young people, getting to hear their stories, getting to hear their background or where they're coming from, young people can have that opportunity to be successful young people or work towards striving to their goals, because a lot of the students that I was surrounded by did not really have those resources, or really wasn't focused on becoming millionaires or becoming these big time people. They were focused on making sure that they eat when they got home, making sure that they have the resources that they can give to their parents, because and I did live with a lot of students, or surrounded myself around a lot of students that were struggling economically, did not have the certain resources compared to their counterparts, etc. So such as like the free after school programs, which there are programs out there. I know like Soul Fisher Ministries within the Riverview Garden School District has been doing a lot of work, such with after school programs with tutoring, mentorship, etc. College reading readiness resources. Just tapping in on a little bit about that. A lot of, I would say, St. Louis County School District specifically, a lot of students are struggling from low reading scores. So we want to make sure that those students have those resources if they need to have someone that can help them pick out the right book for them, or have, just having the opportunities for them, for young people to be able to just uplift their reading scores, etc. Mental health support and trauma, as we know, those are like the basic necessities that, we all advocate for to go into school districts. Again, I feel like I keep relating back to my school district because that's where I was grounded and rooted in, and I learned a lot from the specific school district, and I could just only imagine how other surrounding districts were struggling in the same area. My high school only had one therapist for 700 and something students in the school. Can we make sure that, we have more therapists, or if we have to put more funding to make sure that we're getting the resources that we need? Community cleanup and arts-based revitalization projects led by youth, having that opportunity for young people to actually be in their community, see what community service looks like. I know I live by the quote by the late great Congresswoman Shirley Chisholm. She states that service is the rent that you pay for room here on earth. I want to make sure that I'm giving back to my community, because this is a place that I not only grew up, but this is where I live. And I want to make sure when I'm walking out of my house, or if I'm walking in the neighborhood, I want to feel like I stay in a safe environment that's up and kept, because once you stay in an environment that looks clean, you feel good about your community, etc. Another one that I had was the county youth county youth participatory budgeting program, having an opportunity where it can be a youth-led budget. So for example, this will be, I know I'm speaking out of the ordinary right now, but like just thinking about how young people can be a part of the decision making process. So if the Youth Advisory Council can come up with something, or if the county executive can put something to the side where it's a youth town hall and there could be a certain amount of funds set to aside just for youth in St. Louis, how can those funds be distributed? Having that opportunity to, if some students want to say that they want to create community gardens or launching peer tutoring centers, you do hear this constructive criticism that a lot of young people say that they feel like they listen more to other young people, because not only that they can relate to them, but they're very transparent. So if we can set funds aside to that, and also entrepreneurship fairs. I know that there are a lot of organizations out there that do go to schools, such as like the Little Bit Foundation. Better Family Life has thrown a few events, and etc. Just some organizations out there that can be able to, even help or set aside. It don't even have to be like the St. Louis Youth Advisory Council, but it can be an organization that we could probably partner with that has a certain set of money that young people could come together. We have a town hall or something that can be orchestrated where young people can actually have the opportunity to distribute where funding should go in certain areas, or have like a mock event or something orchestrated around that where young people could be able to do something similar. And another one that I had was the Youth Policy and Fellowship and Housing Justice education. So basically launching like a policy fellowship focusing on like the history of like St. Louis County, and also the policies that was constructed around like concentrated poverty in St. Louis. So basically it would be like workshops on redlining. I know that me as a WashU student, my freshman year of high school, I had the opportunity to uh, be in a class called what was it called, Environmental Justice and Racism for Everyone in St. Louis. So I had the opportunity of learning about redlining, mapping, concentrated poverty, county governance, etc. And we took field trips to certain historical like places in St. Louis to learn about, this is where this started. This is how this highway was built on this certain community or this neighborhood. So to me, that was very insightful. So having opportunities like that, or even having opportunities of visiting the St. Louis County office, see how certain departments work. I know that St. Louis County is kind of split between Clayton and also St. Anne, but just basically learning about policy and legislations that can also help students with resolutions with their community. And I know that in the bottom, like I talked about the role of like the Youth Advisory Council, because Annika, you have been a good advocate for the Youth Advisory Council for us to make sure that we are bringing that seat to the table in any way, shape, or form. And we just want to continue to, I would say, elevate young voices and impact the neighborhoods. And if we can, host listening sessions and form partnerships with local nonprofits, etc., having opportunities of speaking to someone today about Narcan and the opioid abuse, and how can we rectify that misconception of how it's perceived, and etc. So I added like some resources below of like a lot of the work that St. Louis local community organizations are doing. Like Beyond Housing is a great one, which they support 24/1 Cinema. Is it? I believe it. Yes, 24/1 Cinema communities, and they like help assist with like implementation in the Normandy area. 24/1 Cinema. It's just a great, I would say, place to go watch movies in St. Louis City, and they also support a lot of Black-owned businesses, etc. I know that when my university came to go watch Beyonce, we actually went for free. Like that's things that our Association of Black Students from my university came, and like there's things like that. The North County Incorporated is an economic development group that focuses and offers internships and youth engagement. The St. Louis and Integrated Network, the Legal Services of Eastern Missouri, and then also like the St. Louis County Department of Human Services and all that, which we know. So um, I did like reach out and look at my website on my university, of like the university, my university, Washington University, of course, WashU, which Brownsgood is really good to help with like research, and if we want to do more information regarding that, and also UMSU's public policy program. So yeah, so that's just a little bit of, some funding opportunities to Deaconess Foundation. I know that I was just visiting there a few weeks ago. Like that is just a great place that we could, like, if we want to, or something that we can do first, like in the future. I know, like I said earlier, I'm speaking out of the ordinary, but it's just how my mind fluctuates sometimes. They're a great place to reach out to. Missouri Foundation of Health, Youth Bridge, and the county's America Rescue Plan Act. So there may be some emergency funds that we can probably pull out of there that could also help and assist. So that's just a little bit of what I have so far.
Thank you so much, Precious. That's so in depth, and I can tell you think about it and you're really passionate about your community, and it's really great to see. Like, it's incredible. I had a and just a few pieces of advice for the Youth Policy Fellowship. I know right now that that's a fantastic idea. Like field trips to the historical sites and like workshops to help with like education, especially relating to like all the different things regarding racism in like St. Louis City, as well as like a capstone project. I'm reading off of your report, but I think that's a really, really like really good idea. And you should reach out to your county councilwoman because I bet she would totally like work with you to sponsor legislation to help set that up. So I know that's not something the Youth Advisory Council can do beyond like push it forward in our report, but I bet
Yeah.
are you with Shalonda Webb? Do you know? Is that yours?
So you know I'm staying in Clayton now. So I believe in Delwood, where it's my home. I think that's incorporated. So I think mine is Redder Days.
Oh, okay. Well, she
Hmm.
totally jump on like trying to like form this with you and like trying to like write a proposal and like create this program with you as like another program which watch that's not something the Youth Advisory Council can do, but if I can be of any assistance in connecting you with her or if you want to just reach out to her, I like that's such a great idea that you should totally go for it and I wish that was something that we could do. I did have one or two questions about um, just some ways to help like implement some of your ideas.
Yeah.
Okay, so you talked about reaching out and outreach, how there might be some programs out there, but students don't always know about them. For like the St. Louis County, do you think it'd be a good suggestion to like get a lot of their programs to start going towards schools and like help them like get flyers in the schools or so like students really know about them?
Yeah, I feel like okay, St. Louis does a good job with promoting on social media and having flyers outside of classroom doors. Like the outreach is there, but I don't feel like the interaction is there with students, if that makes sense. Like I know that I mentioned earlier that like students, the resources are out there, but students really don't know about them. I wouldn't necessarily say that they're like just mind blown that they just never seen any of these resources before. I think that is more of going into the classrooms, actually having these conversations with students, getting to see what their day-to-day life is like and how can their specific organization help aid them into the right direction. I know that I always share this quick story, but I was one in my library. I feel like I keep going back to high school, and we had like a really rich person come, and he was talking about getting all these $1 million cars and how he was just this successful person. Then we had another person who come in and they talked about how they were incarcerated and they changed their life around and they shared their just events that they've been throughout their childhood and how all of the students were really invested in that person who literally went through all the things that a lot of these young people are going through now. So if we could have more of that, just that human interaction, if seeing how can we reach out to organizations. I know that St. Louis County, our Youth Advisory Council can't physically do that, but the more of the outreach is actually having conversations with students. I know that there are a lot of mentor programs out here, especially for young men and young women, big brother, big sister, etc. Just, something that is really going to aid our generation to the next level because I feel like now we're living in times where we are constantly reminded of we have to do something now, and us young people, we are all we have. So if there's, I'm just big on that. So yeah, I hope that answered your question a little bit on.
Yeah,
So, yeah.
like starting a program where we like bring out St. Louis speakers, especially people like from the area that maybe have like are in successful business and helping to like connect them so they can like mentor them and like relate to them. Something like
Yeah.
that.
Yeah.
And then the other thing I noted is that it might be a good idea to specifically like adding this to one of the like things in maybe your report or a future report would be like surveying the students and kind of asking them like what they need, where they feel they need to be met, because that seems like that's another disconnect that you're talked about a lot, is that like students like they don't feel reached, or like the resources that we have aren't necessarily meeting their needs. So some way to get like a direct student survey, like
Yeah, people call me an old soul, but I feel that we're doing all we can do with the young people, even with like going into schools, and parents. You try to ask parents to come to town hall meetings, they can't come in person, they try to switch it to virtual, they still don't come. And it's like those are the parents that have a lot to say about the school districts, and we're being honest, and they're doing the work. I would say St. Louis is doing the work, but one thing about me is that I'm just not going to give up. And I'm not specifically not going to give up on St. Louis youth, especially. But if it's just organizations now have to come meet the young people, and we have to go back to how the community used to be back in the day, knocking on your door and just seeing who's in the household, or if the family is comfortable of sitting down and speaking. Because if we're being honest, when we have these community organizations and events that are thrown out, some parents are afraid to speak out publicly and say what's going on in their households, are afraid to say this is what's happening to my child, or are afraid to just ask for the resources publicly. So we have to do that personal one-on-one action, not just with students, but also with parents too. Just coming together as a community as a whole. So I do think back to what you stated earlier, surveying students and youth would be a great a great asset, etc.
okay. Does anyone else have any questions or comments for Precious? Okay, thank you so much. That was very insightful. I really enjoyed listening and learning about that. Um, we can't do this because we don't have quorum, but our next meeting in June, we will approve the report. Then we will send that to the Youth Advisory Council. And then the next thing on my list is just some follow-ups on different presentations or like future endeavors, and just giving everybody an update about what we will be doing for the next 2 months, the final 2 months of the Youth Advisory Council. So for the Youth Advisory Council report presentation to St. Louis County, it will be in either June or July. I haven't narrowed down a specific date yet, but I'm excited to say we are going to have it in June or July. I'll give everybody at least a 2-week advance on when that date is, so everybody can figure out if they can attend, if they can attend, if they want to speak, what exactly we're going to present. So that is happening. I was supposed to get a date, but because of the tornadoes and the internet, it's been delayed a little bit on getting the exact date, but that should be coming very soon. And then for the next 2 meetings, I'll ask you guys in a little bit, but what exactly are we interested in doing? Because I know we're gonna have Mrs. Hughes speak on all of the different county youth programs on one of the future meetings. I'm hoping to get one of the social media coordinators out here so we can speak to them about partnering with them. So hopefully that will happen in either the June or July meeting. And then we'll also have that Youth Advisory Council presentation. And then the next thing is doing a Youth Advisory Council volunteer day. So in either June or July, I would love for the Youth Advisory Council, whether it be formal as like a formal activity for us, or if we're not allowed to do something formal, like an informal show up if you can, Youth Advisory Council day with a volunteer day with youth on the rise. I don't know if there's a specific time or way that we need to like reach out to them to ask if we can volunteer, or if that's something that Mrs. Hughes can speak on. Right now, like when is a good time to volunteer, but I'd love to just talk to everybody, and whether it's like formal, like we do this as an activity, or informal where like we just show up if we can and we're just kind of like volunteer and help out in the community. What times or like days would be good, and like who do we need to reach out to like really initiate this during the summer?
So, in regards to Youth on the Rise, I would definitely be your contact. But there's some restructuring going on, so I'm not quite sure what the summer is going to look like.
Okay.
So I can't say we have space for you or we don't have space for you. But I should know within the next 30 to 45 days, so that still gives you a little bit of summer left. Um, what volunteer opportunities will look like.
Okay.
That's
Perfect.
why I haven't talked about Youth on the Rise and the program. I keep pushing it back because we haven't landed on some restructuring, and I don't want to bring you all say, hey, yeah, you know what, this is what's going on, and we completely revamp the whole thing. So I appreciate your patience and understanding.
Okay. Perfect. Then I can follow up on the next meeting, or maybe we can hit something back in the July meeting.
That would
And,
be fantastic.
and then I just want to open the floor to everyone here about like any ideas we have for the June or July meeting for additional speakers that we want to hear, or are you guys interested in doing another report? We totally don't have to, some are super busy, or just what direction you guys are interested in going in for the next two meetings, because I know we should have the Youth Advisory Council presentation. Hopefully we'll have the volunteer day, and then like Mrs. Hughes will present, and then we will hopefully have the social media coordinator present. So that's currently what the lineup looks like right now. I don't know if you guys want me to work on any other speakers or if you have anything else you want to do. So just opening the floor to the people here asking about what they're interested in doing for the summer.
Have you reached out to Courtney, the
Um,
social media person for the county exec?
no, I might have missed that email, but I was not given that. I don't think I was given her email.
Oh, okay. I was just asking
Oh yeah.
if that was the case because I can help facilitate that if necessary.
Oh, that'd be perfect. Yeah, because I know we talked about in prior meetings, like doing some sort of like working with them or talking with them about like getting some sort of youth post up or like some sort of social media takeover. And I know I've mentioned something about that, but I hadn't or maybe I missed the follow-up. But yeah, that'd be great if you could facilitate that with.
There probably wasn't a follow-up because I probably forgot. So I'm glad you said it. I'm emailing her now.
Oh, perfect. Thank you. Okay, so social media. And then I'll open the floor back up to our strong and mighty four members.
I mean, I would really like to see the social media coordinator. I really liked the presentation today that we had. So, yeah, I'd like to see that. And then I don't know about doing a second report. I don't know what everyone else's availability looks like. As you said, I'll be very busy during the summer, moving to Columbia, Missouri, and also still doing newspaper stuff. So I don't know if I personally would be able to do another report. If everyone else can, then that works great. But that's just my availability. And besides the volunteer thing, which again is a great idea that I like a lot, and the social media thing, I don't really have any other topics that I think we could talk about. Just focusing on those two things.
Okay, thank you so much. Yeah, that sounds good. I kind of thought people would lean to like not doing another report because I know we've already covered like I don't know if it's like 12 topics, but we've covered a lot this year. So we've done a lot. But if anybody had like something like one or two things they were very interested in covering, I wanted to give that an option. But also very busy, also very much related. So yeah. Anything from Anne Marie or Precious?
I know that I wanted to see, like, I know, like, us on the Youth Advisory Council, we just provide, like, feedback to the council regarding, like, young people or youth in St. Louis County. But I want to see, like, for future purposes, how can we be more involved in the community? I know that we do meet on Zoom once a month, but I'm really just eager to see how can we really make more of an impact in the community um, outside of Zoom. If that's like volunteering in the summer, I mean, in the wintertime with I can't think of that organization I just volunteered with Miss Charlotte earlier in December. It's slipping my mind right now. But doing work within that, or attending. I know that we have a meeting in July. I wanted to ask you too, Anna, but I must have just missed it. Or like, what specifically are we doing? Are we showcasing our proposals to the county executive and the St. Louis County Council? Like, what are we doing exactly regarding that? So I just wanted to see more of like, yeah, like if like do we have to reach out? But I do want like the future of the Youth Advisory Council to feel like that they are really doing meaningful work in St. Louis County. And I feel like us doing these Zoom calls once a month is vital, but like really having like that boots on the ground type advisory council. I couldn't find another word for that, but yeah. So I'm just interested in hearing more of what can we do.
Yeah, so I'll start. So our summer agenda right now, we should have the presentation to the county council in either June or July. We don't have a date set down for that. That'll be separate from the day we have the Zoom meeting for the Youth Advisory Council, but I've not been given a date for that, so I will send that out to you guys 2 weeks in advance. Hopefully, I've been trying to get this together for months, so hopefully it'll come out. So that's the first thing on our agenda. The second thing hopefully we'll get the volunteer day depending on what's going on with the Youth on the Rise program. And then the 2 things we'll have at the meeting is we should have in June, hopefully we'll have the social media coordinator there to talk to us. And then in July, hopefully we'll have Mrs. Hughes talk about like the county programs, and then we'll have like any planning or follow-up for the volunteer day if necessary. So that's kind of what our agenda looks like for right now. And then in the future, I don't know if I'm going to be on the Youth Advisory Council next year or if anyone else is, but I think leaning into informal or formal volunteer days. So maybe doing like 2 or 3 of those a year with different community organizations would be a really good idea for the next like year's Youth Advisory Council to really help people get more out in the community, especially since we spend all these time on reports and finding all of these like different cool organizations. Just taking the time as a group, both for like our bonding and like mostly to help the community, going out, maybe doing like a winter one, a fall one, and a spring one, or something particular to that would be a great suggestion for the next year's Youth Advisory Council. And hopefully we can get our first one this year so we can set a precedent of being more out in the community, like Precious said. And then one more comment regarding community. At the Youth Advisory Council presentation to the county council, at the end of our presentation, after we presented all our wonderful ideas, I was working with my councilman, Mr. Harder, and I think we were going to present legislation to change the Youth Advisory Council to a more like youth like activity council or something similar to that. So I was hoping that we could do this presentation because then we could pitch it at the end. So after they see all us and then we get like the TV and the cameras and they're like, "Oh, look at all these wonderful youth ideas." And then we can be like, "Well, if you just like pass this, then we can do all of that because we're awesome go-getters." So that was hopefully my idea if that presentation ever happens. But yeah, so I think next year for sure more informal volunteer days, and I'd love to get the Youth Advisory Council both like to do these presentations because I think they're helpful if people are like reading and engaging with them, but also like make it more active, like, and get that legislation passed if possible. So that's my vision for the next 2 months in the future and my suggestions. So
Yeah, I think that that's great. I'm sorry it slipped my mind, but I do be forgetting that we're all spread it across Missouri. So it can be hard to get all of us, in one room, with the distance. So it does slip my mind sometimes. So I did want to take a knowledge to that.
oh yeah, I was thinking one of the other things I really wanted to do this year, and it just didn't work out because of all the different like stuff that was going on with all the tornadoes and natural disasters and all this different stuff that was building on at the county. But having a hybrid option would be something that I would love to happen, either like sometime in the future where if people are in St. Louis County, then they like could come into one of the buildings, so like you could meet in person and talk in person to help foster more ideas, as well as giving like the online option. So that's another thing that hopefully will get done sometime. But yeah, I
Thank you.
hope your questions. Yep. Does anyone else have anything?
No.
Okay. Mrs. Frank, are we allowed to schedule our next meeting?
Well, you can't vote on scheduling the next meeting. You have the authority, depending on how many meetings you may have already had, and I can look at that and see how many meetings you've had since August, if you give me just a second, which I believe is the beginning of your meeting year every year.
Mhm.
So let's see. So you've had quite a few meetings. Met 1, 2, 4, 5, 6, 7. So you only have to have 8 meetings before by ordinance before July 31st. But so additional meetings can be held upon call of the chair. So you have the authority under the ordinance to just set a meeting. And if you just want to ask folks right now if there's a certain date that they're available, you can certainly do that.
Okay. For the June, so normally we do the last Tuesday of the month for our meeting time, but I am going to Girls State, so I won't be available during that meeting time. So I know Akil isn't here, but I was going to ask you guys, would you do the meeting on June 17th and move it to a week earlier? Or if Akil is here and I'll just reach out to him, would have like him coordinate the meeting, or if he can attend, have Mrs. Hughes carry out the agenda.
Well, you will have to have someone preside over the meeting who's on the council.
Maybe then I'll just switch the date to June 17th then, if that works for the people on there.
Okay.
And that,
Like I said, you have that authority under the ordinance.
okay, I'll give everybody a second or two to check their calendars.
I should be free. I just tried to check my calendar.
Okay. I'm free on June 17th, so I'll put the next meeting on Tuesday, June 17th at 6 p.m. the normal time. And then do I need to officially motion to adjourn, or can
Unfortunately, you can't, so you'll just have to say that your discussion has ended.
our discussion has ended. Thank you guys for going to this long meeting with a lot of discussion, and thank you all for showing up. I know this is finals week for a lot of people, or like there's different stuff happening, so thank you everybody for showing up. We'll see you.
Thank you.
Good evening.
Good
Good
evening.
Bye-bye.